Well, Minnesota has complied now with a federal pause on the Johnson & Johnson vaccine as recommended by the U.S. Food and Drug Administration, as well as the Centers for Disease Control and Prevention. ABC 6 News reporter Mackenzie Davis joins us live in studio tonight with how local health leaders in our area are responding. Mackenzie?
Laura, this pause of the one-dose Johnson & Johnson vaccine was recommended early this morning after 6 women ages 18 to 48 in the United States reported rare blood clots 6 to 13 days after receiving the vaccine. One woman has died and a second woman has been hospitalized and is in critical condition. Governor Walz says this pause is being done out of an abundance of caution and should only last a few days. The state of Minnesota has been told they will still be receiving a high number of Pfizer and Moderna vaccines to make up for this pause with the Johnson & Johnson vaccine. Only 5% of the 3.3 million doses administered in Minnesota have been Johnson & Johnson vaccines.
One of the problems with these types of rare events is they're so rare, it's really hard to prove anything one way or the other.
Such as knowing after a couple of days looking into this if the vaccine actually caused these reported clotting issues.
The fact that they caught this signal with only 6 cases should be reassuring to people that the safety monitoring of these vaccines is happening at a very deep and comprehensive level. So the process, even though the vaccines were produced quickly, they're not cutting corners when it comes to safety.
Both Mayo Clinic and Olmsted County Public Health are going to pause the use of the Johnson & Johnson vaccine, continuing to use Pfizer and Moderna. If you experience side effects such as a severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks of getting the J&J vaccine, you are advised to contact your healthcare provider.
Those symptoms are not symptoms you normally see after you get a vaccine. They may be symptoms of a clotting issue.
At both Olmsted County Public Health and Mayo Clinic, most of the doses they have received have been Pfizer and Moderna, but this pause could create issues for pharmacies.
The pharmacies that are being supplied through the federal system have been getting more of the Johnson & Johnson vaccine, and so it's possible that they may see a little bit of a difference here.
The state of Minnesota is not aware of any cases among those who got the Johnson & Johnson vaccine. By this afternoon, more than 40 states quickly paused or recommended that providers pause administration of the Johnson & Johnson vaccine dose, including Wisconsin, Iowa, and Illinois.